Oh, great. Great. And so thank you all for joining. I know more people will be joining as we keep going with the webinar. I'll introduce myself. My name is Zane. I am with Polygon Education Fund, and I am a legislative fellow. A little bit about Polygon. We do these congressional advocacy trainings and to help encourage other people to reach out to their legislator. And we are excited to have Engage and American Muslim health professionals join us today. And I'm going to let Sana introduce herself.
Thank you, Lajane. Thank you, Zane. So my name is Sana Syed. Thank you all for joining us. I am the Health Policy and Advocacy Director for American Muslim Health Professionals. My day job, however, I'm a board member with AMHP, but my day job is as a neurologist. I have a public health background, and I actually work as a senior medical director at a pharmaceutical company. However, today I am presenting to you guys as a representative of American Muslim health professionals and with the focus on public health and healthcare issues. What American Muslim health professionals essentially does is that we are we are a group of Muslim health professionals who are committed to public health and healthcare issues. We work in the space of advocacy, which we are doing right now in terms of advocacy trainings, working on different public health issues that are of critical need right now. For instance, we have initiated a number of efforts in the related to the pandemic currently. We also have other elements of our activities that focus on professional development and mental health. However, today will be restricted to advocacy and various activities related to that. And we will touch on some of the initiatives and efforts that we have related to the pandemic recently and otherwise that you guys can be more engaged with as well moving forward. And with that, I'll hand it to Mustafa.
Hello, everyone. It's nice to spend some time with you all today. My name is Mustafa Rashid. I'm a policy fellow with Engage. Engage considers it to be the political home for Muslim Americans. We operate across the country, primarily in 5 states, and including a national team headquartered in DC. Our approach is 3-pronged. We look to civically educate Muslim Americans, especially by introducing Get Out the Vote initiatives for the big elections. We have a political action committee that looks to empower candidates, Muslim American candidates who meet our platform to run for office. And we engage in policy discussions. So we advocate for certain bills and initiatives that align with the interests of Muslim Americans. And that component of Engage is called Engage Action.
Great. And Sana will be going over more about the National Muslim Task Force and the policy committee that we're part of.
Thank you, Zane. We just wanted to go over how we have gotten together and how we got to the point that we are doing this advocacy training. So basically, when the pandemic occurred, we realized that there was a huge need for a response from the Muslim community related to issues within our society and also overall. Initially, we came together to ensure like certain safety measures were taken in religious congregations and what have you. And we were able to get over 40 organizations together consisting of faith leaders, healthcare bodies, public health organizations, social justice and policy experts to get like a cohesive response in this crisis. And of course, the initial element was we need to ensure that American Muslims are aware of the problem. We need to educate. We need to ensure like the message got across that everybody needs to stay safe. But then we also realized as we were doing this that there was also a broader need as well. And for that reason, we did split up into different committees, one of them being the policy committee. And this is how I started working with both Zain and Mustafa, namely Mgage and Polygon. So the policy committee, definitely we are looking at various issues. We also various healthcare issues that are occurring. But the message overall is that in a public health crisis of this proportion, there is no one community. It is one large community. Everything affects all of us. So we really started working on different initiatives related to increased testing, increasing PPE, ensuring proper protections were there for various healthcare workers, and just like having a proper response to the pandemic overall. So it was born out of an initial smaller need, but we quickly realized how important it was to work towards issues that are really affecting all of us in this, and that is the nature of healthcare and public health, that it impacts all of us. So we all need to be working on it together. And we've also looked into like food insecurity, the impact on the financial impact on small businesses. So that is what currently we are the policy committee of this larger Muslim task force. And these are kind of the different activities we are doing. And this advocacy training is actually one of those elements of advocacy work that we are doing as part of this overall committee and the work that we need to do in this space. And I'll hand it off back to Zain.
Great, thank you for that, Sana. And with that, we're just going to jump right into it, starting with civic engagement. In the past couple of years, civic engagement has been very low across the spectrum. As an example, in terms of the people that we represent, only 17% of American Muslims have directly contacted their congressional representative in the past year. This is the lowest in all faith groups in the US. So these trainings are intended to help encourage others and allies as well to take action and reach out to their elected official. And at the end of the day, we all have to work together. And something to highlight is that the rate of engagement is increasing, especially this past year alone. We've noticed that there are a lot more people getting engaged with their representative. And we're going to be going over the basics of Congress. So maybe really quickly in the chat, if someone wants to type in how many people are in the House and versus how many people are in the Senate. So if you want to type in your response. Maybe people are having a hard time finding the chat. Yes. Okay, great. Yeah. Someone put 435 in the House and 100 in the Senate, and that is correct. So there are 100 members in the Senate, and they serve 6-year terms. House of Representatives, there's 435 members, and they serve 2-year terms. This is important to keep in mind because, especially for the House of Representatives, they serve these short 2-year terms, and if a representative isn't passing policies you agree with, you and your community can potentially jeopardize their reelection. This goes for the Senate as well. I think we have seen this a lot in the past few years of seeing districts flip. So something to keep in mind. The role of Congress. So Congress introduces bills, they approve political appointments. So when a new president gets elected, they will appoint people to be in their cabinet. And this will be secretaries, ambassadors, advisors, really important positions in the federal government. They also determine federal budgets and serve on committees and subcommittees. I'm going to pass it to Sana now, and she'll be going over the critical need for advocacy in healthcare.
Thank you, Zain. So I'm guessing since all of you are here that you do understand that advocacy is extremely necessary in the healthcare and public health space. However, I did want to go over some of the nuances of why that is, what is the actual need itself, who needs to be engaged and who is also being impacted. And then I will obviously hand off to my colleagues to go over how we actually get this done. Now, I will emphasize, since we have a very diverse crowd, that even though we mentioned that the Muslim community off and on, we do think that we know that all of these elements of advocacy are universally applicable. So this is not specific to a particular community. We have data related to the Muslim community. However, it is simply to help you think about your own community as well, because we start with our immediate communities, but in the end, we need to work together, as Zain mentioned. So that is kind of the idea of this training, that we need to be all on the same page, doing the same thing, and talking to our friends and colleagues to get them on the same page. And then in the end, we will all meet at one point. So what exactly is happening right now? We have a healthcare crisis. A lot of people will say that the current pandemic is the healthcare crisis, but you could also make an argument that there was an ongoing crisis and it has just exploded right now. And that really is the consensus, I would say, from a public health and healthcare perspective. Everybody agrees that our system was a little weak to begin with, very weak rather, and this is why we haven't been able to handle what's happening right now. So we have, sure, there was a pandemic and it happened and it was a major problem. I'm a physician myself, I know this is no joke, but at the same time, I also think about the fact that if we had certain provisions in place, how different could it have been? So that is what we need to think about. So it's not like, of course, we ourselves got activated more so because of the pandemic. However, we do have to realize now that as this continues and as it resolves, we just cannot stop working on these issues. We need to make this an ongoing engagement, because the fact that we have so many uninsured folks, that we have a problem with food insecurity, like I said, is also a healthcare crisis. And now we are waking up to a fact that has always been that racism is also a public health issue. We see it in the past week more so, but honestly, since the pandemic hit, we also know that there were these healthcare disparities that are rooted in racism. So we have to acknowledge that there's so many problems that we need to fix, and we need to work on it now and keep working on it later as well to ensure that we make a change. Now, moving to the next question, which is who needs to be concerned? Well, all of us for sure, and everyone else as well, because we all need to be engaged. Some of us who are professionals in this space, especially the healthcare and public health space, we see a lot of this firsthand. So our narratives are crucial to making this change. So we cannot back down from this challenge. And then we recognize like who is getting impacted. I brought that up. Now, and I did mention that there are certain populations that are getting hit harder. But I will just mention one thing. When we talk about public health, it is not just that population that is getting impacted. If nothing else, the pandemic did tell us this and teach us this, that we are all connected to each other. So we may be impacted differently, and I will, and by no means say that I know what it means to be impacted in the way that certain minority populations that were hit by the pandemic, and there was an extraordinary loss of life in those populations. But at the same time, we are still connected. Why? Because there is some trickle-down effect in a different way. We were impacted because this lockdown will continue till everybody is better. Because the unifying goal is that we are working towards the well-being of society, not that one population or that other population that is managing to hide away. I may even be one of those people who has that luxury, but at the same time, it is everybody. I'm not saying that I really would like everyone to be focused on the fact that we need to work towards everybody's well-being. that is what it's impacting us all. We just see a disproportionate amount of impact right now. And we were able to ignore that impact historically, it seems, but now it is front and center. And this is definitely a wake-up call. So with that sense of urgency, I hand it off to Zain and Mustafa, who will collaboratively explain how to get this done.
Yeah, and thank you for that, Sana. And we will be going over advocacy right now, which plays a very important role in Congress's decision making. We know that elected officials create policy change, but an important factor to consider when thinking about the policy change is that you and your advocacy can also play a really big role. We also know that there are other sources of influence on politicians. Of course, some listed here can be the president, it can be political parties, it can be any sort of media. Quickly in the chat, if anyone wants to mention different examples of sources of influence, maybe a media outlet that is covering a lot of these issues. If anyone wants to mention it in the chat. Now I'll give an example. Fox News is one. It could be a party leader. If it could be Mitch McConnell, Nancy Pelosi. It seems like we have a shy chat, so I won't pressure anyone to mention it right now. But yeah, but I think it's important to remember that you also have a voice and the ability to influence politicians along with the other factors. And that's where I want to highlight that constituent advocacy does work. We've seen it work with direct constituent interactions, have directly influenced policy making. Why do they work? Representatives need to appeal to their constituents to get reelected. I'm going to pass it over to Mustafa, who will speak on his experience and his role in Engage.
Thank you so much, Zain. Yeah, absolutely. What I want to start out by saying is highlighting what Zain said. We all know that there are so many different factors that contribute to policy change. But by far, the most important, even though it's so simple, the most important is constituent to elected official interaction. And within that sphere, there are so many different ways you can go about it, through social media, through working with an organization like Polygon or Engage in order to connect with your official and have meetings those ways, calling into the office. Members of Congress need to gauge their understanding of their constituency some way. And even though angry letters and calls don't seem to stick out, I will tell you that offices are really data driven about how many people per week are calling about about what particular issue. So just some of my experience, I've spent the past year working here in Michigan on foreign policy issues, namely China, Burma, and Kashmir. And even though those are foreign policy issues, this method is effective in almost every issue, including healthcare. So we would go, our team and a number of constituents who wanted to come with us, we'd go to the in-district office. We'd, introduce ourselves. It depends. Some people feel a little bit uncomfortable with speaking with someone of a different political ideology. You can be more candid with a member of Congress you feel more comfortable with. You can be a bit more reserved with someone you don't. But in the end, no one can be upset or angry or combative over your personal story, because your personal story is one of several hundred stories that have to be represented by this member of Congress. So we would go, and our constituents and us, we talked to the member of Congress about our personal stories. In foreign policy issues, it's related to people who we have back home about human rights. But those same themes can absolutely relate to what's going on with the pandemic. And we'll talk a little bit about our personal stories later, but that evokes emotion from the member of Congress. And there's so many things they can do from that point. They can do stuff from putting out a statement. They can vote in a way that you want. They can sign letters to various government agencies like we've had them do in foreign policy issues. And at the very least, you have an open line of dialogue that evokes emotion and sincerity from the offices. So constituent advocacy is the most effective route to go about it. And if everyone does it together, it's going to create change. So I'm going to turn it back to Zane.
Great, thank you for that, Mustafa. And just to give a few examples of how constituent advocacy works, a few years ago, you might remember members of Congress were trying to repeal the Affordable Care Act. Organizations and individuals sent action alerts on information about the proposal and its impacts and how to connect directly to your elected official. So a lot of citizens called and visited offices to tell their members not to vote for the repeal. And enough senators committed to vote against the party line to block its passage. So that's one way advocacy works. Another example, we know that food security is a public health issue since nutrition is a critical element of people's health. Recently, advocacy groups have been pushing for SNAP increase in the CARES Act. After outreach with representatives, offices, and social media campaigns targeting these key representatives, there was an increase of SNAP funds included in the most recent CARES Act, and which also shows advocacy works. And even policies that can be very diverse between party lines. Here we have an example of the CNN town hall with the elected officials. Senator Marco Rubio, who has received a lot of donations from the NRA, and constituents reached out to him who were affected by the Parkland shooting, and they were able to confront him about his stance on guns. And he went to propose a gun violence prevention bill. So public pressure can definitely make a difference. We mentioned this because gun violence has been classified as a public health issue by many public health bodies, such as Harvard School of Public Health. And just another great example of how advocacy works. So moving on to 3 names that you should know. It's your 2 senators and your representative. And this structure is a typical office structure of lawmakers. The box that's highlighted in red shows that these are the people who you'll be interacting the most if you go to an office visit. Because right now we're in social isolation, a lot of the offices are closed on Capitol Hill. And so you'll be engaging with them through email, phone calls, and virtual town halls. But so you'll most likely be engaging with a legislative director, policy advisor, even legislative assistants or legislative correspondents. And sometimes even over the phone, you'll be interacting with the interns, and they will be passing on the information to the representative. And here we have a congressional advocacy, a few tips that you can follow to help you when you're reaching out to your elected official's office. So when calling your elected official, be sure to take some of these steps. Know who you're calling, who's answering the phone. Make sure to identify yourself as the constituent. Have a script ready. It's easy to get sidetracked with your words, so having something written down and being prepared is a great idea. And make sure to keep it short and sweet. For this, Mustafa is volunteering to be our constituent.
Yeah, I mean, the script is right there, and we'll talk a little bit about how these scripts play into our action alerts later. But it's very, very basic, and it has room for you to maneuver. So I'd say, hi, my name is Mustafa, and I'm a constituent of your senator or representative. I'm calling to express my concern regarding the shortage of coronavirus test kits in the United States. Just an example. Now, this is where you can get creative and share a personal anecdote. The most important part of these calls is to tell your story. And just another point, in this pandemic situation, you will most likely, if you're going to interact with a member of Congress, it's going to be through their in-district office. And they have a responsibility to you if you want anything from a call to an online meeting. But back to this, on the personal anecdote, since we're talking about healthcare and health workers, it'd be very prudent to say, I'm a doctor and I just witnessed that massive influx, and I didn't even have any protective equipment from the beginning. If this is about testing, all these people are coming in and they're all getting tested. Well, who's the one who's giving them the virus? Are they getting tested? This also applies to not even doctors, but nurses and EMTs, people who work in nursing homes. Where is the testing? And to give that personal connection that you know someone who's maybe been infected by the virus, or you've seen it on the job, you've had to take that burden. When my whole responsibility wasn't to, I wasn't like, even though I could do it, I as a medical professional never should have to dream that a pandemic could ravage our healthcare system. So as a professional and a member of your constituency, I'm upset, and we need to get back on track. So that's an example of the personal anecdote that you can bring. And of course, it doesn't just have to be about you being a healthcare worker, but really anything, because it's important to have that dialogue. That's where you can get creative. And of course, the rest of it, thousands of people are in need of testing kits. We need you to support the HEROES Act provision, and it gives all the details of the act. Go look at the act yourself. You can find all this information online and become educated. But these basic scripts are going to help you a lot.
Great, thank you, Mustafa. And we are going to go into some action alerts that we can take right now. So handing it back to you.
Okay, so the task force under Sana's amazing leadership, proposed that we make it as easy for constituents to reach out and connect with their officials as possible. So we have action alerts ready to go for everyone. It gives a description about the issue. It gives an option for you to put in your information so the office knows where you're coming from, who you are, and it provides an email script. And Lujane has put those action alerts on the chat. It gives you a script to operate through. You can manipulate that script if you want, and then you can send the email. And this the action alert isn't just email. It also gives you a mechanism to tweet at your officials and call them. So we are going to continue to produce action alerts. This is one for testing. In the next slide, you can see the one about personal protective equipment. These are there and ready for you, and you can do them right now, literally as we speak. It does not it may look like a lot of information, but I put more information into my social media accounts and other stuff I shouldn't really care about. This I should care about. So it doesn't take long. You can do it really fast. And if we all do it, we can, again, make a lot of change. I'll turn it back over to Zane.
Thank you. Great. And that being said, you can also do advocacy on social media. Where a lot of us are social isolating. Some of us choose not to go to protests. We can't go to our congressional offices, but you can connect directly to your congressman from social media accounts. So here we have a few tips. You can tweet at your elected official, use hashtags that relate to the cause or the advocacy issue you're working towards. Respond to an elected official's account, whether it's something you agree with or disagree with. Retweet posts from advocacy groups such as Engage and Polygon and AMP, and activists that you agree with. Just a tip that when you're tweeting at an elected official, just add a period at the beginning. In this case, like dot at Senator Sanders. It just makes the process go smoother. And then there's other ways to get involved on Twitter. There are live tweeting. You can live tweet or you can participate in tweet storms. So a lot of advocacy groups will organize tweet storms, which will be on specific days. And they're impactful because it spreads awareness and that they can get on the trending page. And then another thing is if you're watching a broadcasting or an event that matters to you, a lot of people are doing virtual town halls. They're doing, now the Congress is moving to remote voting and committee hearings. So you can be tweeting during these events and broadcasts and share your thoughts and use relative hashtags. And even if a representative says something you agree with or disagree with, you could quote them and tweet that as well. Here are some examples. This is Polygon. We tweeted a article just, sharing information, and then AMP was participating in a Protect All People tweet storm. And so this is kind of how organizations will do it, but individuals can participate in this as well. And then there's advocacy on Instagram and Facebook. You can be posting your advocacy work on Instagram. This helps spread awareness of your work and what you're doing and the cause that you're working towards. And be sure to share posts on your story. It's a really easy way to stay updated and share information with others. And we will be going over town halls. So right now, because of the pandemic, a lot of town halls are virtual. And the way you can find out about them is joining your representative's mailing list. Even call them and ask them when their next town hall will be. And so this is a great way to get right in front of your representative. An example, around the time of consideration of the repeal of the Affordable Care Act, there were a lot of town hall meetings scheduled, and people were meeting with their members and having passionate conversations about the ACA, whether it was to remove it or keep it. But it really showed how engaged people were with their representatives. And we're just going to go over some tips. And LaJane just sent the guide to the town hall. So if you want to click that directly, I know it's hard to read it on the screen, but just some quick tips. Introduce yourself. First impressions are always important. Tell them where you're from, what city you live in, and then thank the member for being there. Express appreciation. It makes it more receptive, builds rapport, and then tell a brief story. This is kind of similar to the phone calls. Say a sentence or a few about the specific cause and how it affects you and the issue that you're working towards, or the advocacy you're working towards. So your story should be strong, but sufficient. And make a clear, direct ask. Will the representative work towards this issue? Will the representative pass this bill? And then follow up after the town hall. Reach out to the congressman or their staff if your issues were not, addressed. So obtain the contact information to follow up and hold your member accountable for your beliefs, because they represent you. Great. And lastly, a great way to get involved is writing an op-ed. Op-eds can be short, between 500 to 700 words. It has a clearly defined point. It is a great way to get attention of your elected official and your community. It represents clarity of thinking. It has your unique voice, your story, and mention the name of your representative. Getting your op-ed published is a great way to spread awareness of what you're working towards. And for example, we have Sana's op-ed right here. She recently wrote about her experience as a neurologist with a public health background, and she was speaking about the public health crisis that was unfolding for all of us. And in this op-ed, she highlights the lack of adequate personal protective equipment for our healthcare workers and the lack of testing that was being provided in our country. And she emphasized the need of action for citizens to reach out to their elected official and advocate for change. And so Lejane just sent that full article if you guys want to read that. And that's why, another reason we're doing this webinar. So I think lastly, we're just going to say, you got this. Engage with your family and encourage your family and friends to join you. It's great to have support with you and someone to advocate with you. Have those conversations. You don't have to be a policy expert to reach out to your representative. Not being a policy expert is an advantage. Be personal, be authentic. And you're not starting from square one. You have your skills, your networks, your experiences, which are all assets. And reach out to political and civic engagement organizations, for example, such as Polygon, Engage, and AMP. We provide resources for people to take action. And remember that your representatives represent you and answer to you, which is the key part of advocacy when you're reaching out to your elected official. And I'm going to be dropping a link to our trainings. Yes, Sana mentioned we will be sending a recording to everyone. And to learn more about Polygon Congressional trainings or to schedule any in the future, we will be having another webinar coming up soon. So I'll be dropping that link for more information on that. And I'm going to pass it over to Sana because I know she has a few more things to add. Oh, Sana, you might be muted. Okay, there we go.
Yeah, thank you, Zane. I just wanted to add, thank you everyone for joining us and for sticking to almost the end. I wanted to mention that this is just first of our efforts in this direction. Obviously, Zane mentioned she will be conducting some additional trainings. You may also, if you connect with us, we will also be trying to engage with you guys further on some of our initiatives, including further trainings. And this was one of our first ones collaboratively and my first one ever. So I hope it was up to par and it was helpful for you guys. I wanted to mention another initiative that AMP, as part of the overall policy committee, is working on with some of our partners, and that is we are trying to connect. We're trying to reach out to folks who may be interested in directly engaging with their representatives. And this is in relation to the pandemic. So we are looking to engage with frontline workers, other healthcare workers who have been impacted by the pandemic in some way, public health professionals or epidemiologists who are working in this space as well. And the idea is that if you provide us some information about your state and other relevant information, if you are interested to engage further, we are going to collect all this information and work on setting up meetings with different state representatives or congressional representatives to have discussions about the different issues that we are facing in the pandemic. And obviously, we will talk to you guys first, whether we end up talking about PPE or testing or other issues that you guys may be facing in your workspace, or you are researching in your workspace as well. So if you guys would like to sign up, Lujane just listed 2 links where you can provide us this information, and we can circle back with you guys to engage with you further if this is of interest for you. So yes, that was one of the main efforts that I wanted to let you know about that we are also working on currently. And of course, there may also be further trainings and other sorts of meetings in the future. So if you guys could keep an eye out, I will try my best to stay in touch with all of you as well. Handing it back to Zane.
Great, thank you. Yeah, and lastly, if anyone has any questions, I know we went through this we gave a lot of information in a short amount of time. So if anyone has any questions, feel free to answer them in the chat. We will be going over some questions that we received on our forum. So one of them was, how do I start becoming involved in politics as a physician? So Sana, if you want to answer that.
Sure. And just one point I missed out on, we also have a toolkit that covers some of the information that you heard today, because I know there were some latecomers and some folks that had to drop off. So American Muslim Health Professionals has a toolkit, which we will include in our email, and possibly Lujane can also post it in the chat right now. But going back to the question that we received. So I will go over the various questions we received. One of them that Zane mentioned. So we have, so I am a physician now, and I am doing advocacy work as well. So when you say politics is kind of a vague word, but what I can tell you is the different ways that you can get involved in advocacy and the political sphere. Not exactly how to run for like state or official or anything like that. But basically, when I was in residency, one of the things that I engaged in was as part of the American Academy of Neurology, and also the Committee of Interns and Residents, I went to advocacy events with them. And they do provide at those avenues, they provide you some training directly while you're there. And you can, it's a good experience to be involved in these initiatives. And a lot of these physician organizations have an arm that does those types of activities. So I did do that during my training period. So it was an interesting introduction to me. Of course, some of these things related to staying up to speed with advocacy issues and engaging at the level of writing op-eds and watching out for action alerts. That is something that you can do just on the side. Doctors for America is one organization that has been doing a lot of work in this space as well. And recently they've increased their work. And Public Health Awakened, I see that they're doing a lot of public health work. Great organization to work with. I've spoken to some of them, and I keep an eye out on the work that they're doing. So just being aware of these different organizations and the work they're doing is one way of being engaged. You can also check at your state level if there are town halls or other advocacy events that are occurring that you can participate in. Showing up to a training like this is one thing. On a personal note, what ended up happening is after I completed my training and I had some time on my hands, I joined American Muslim Health Professionals as their advocacy director because I had some interest. So I will be honest, I've been learning as I go. Like I said, this is my first training that I'm actually conducting. I've seen one or two trainings before, but this is the first one that I'm conducting. So that I have personally found this platform to be great in terms of connecting with other public health professionals and like-minded professionals who are interested in similar issues. I could advise that other folks who are interested in this space look around them and see which particular organization they're interested in joining, or in what capacity can they serve. So that is another way that you can participate. Sometimes there there are national advocacy days for different organizations as well. You can, if you follow those organizations, you can try to participate in those as well. So I would say that those are the different ways. Obviously, if you end up running for office or what have you, then you have to actually go through a process of fundraising and training, which I am not familiar with, and it's a little bit more complex. But doing advocacy is something that, as a citizen, whether you are a physician or otherwise public health professional or any type of professional, that we should all be doing. So that is that was one of the questions we received, and I do hope that I addressed that. The other questions that I came across were concerning like healthcare disparities and telemedicine. Of course, these are issues that we need to work on. There's a lot of people working in this space. For telemedicine in particular, I know for a fact that most of the medical associations, large medical associations, are working in this space. We have looked at it ourselves, even though we're relatively in a smaller space, but that is an issue that a lot of the larger physician organizations have looked at and are working on. They are advocating for increased benefits for telemedicine and what have you. So that is an issue that is currently being worked on. And similarly for healthcare disparities, it is front and center. I mean, I know for a fact that Human Impact Factor and Community Catalyst, some of the whom have signed up for this as well, for this talk as well. I don't know if they were able to attend. They are working on this. One of the ways by which healthcare disparities is being tackled is through acts, for instance, like Medicaid expansion and Medicare expansion. And also I would mention the HEAL Act. Those are the different avenues in which we're trying to tackle healthcare disparities. Of course, there is an enormous amount of education that also needs to be done, but in the advocacy space, those are some of the initiatives that are being conducted. And I will tell you that it's not restricted to one particular minority population working on this. This is an issue that multiple organizations are working on. I have seen it, obviously. Change takes some time, and obviously in the last couple of weeks those disparities have become more front and center, and therefore I think now efforts have increased and push to enact change has now increased and has been amplified greatly. So you can hope that there is some kind of change coming, but there are a lot of people who are working on this in this space. I do want to reassure everyone. And a very interesting question that we received was about advocacy versus education and potential conflicts of interest when you work for certain organizations. I alluded to the fact that I work for a pharmaceutical company. Again, I am not presenting here in representing their views. Obviously, I am doing this more as a private citizen. So that is always, so what I just did, that is extremely important when you are engaging in any form of advocacy. You have to ensure that, because working for any company or organization does not take away your rights as a private citizen. So making sure that you present that, you express that fact that you are representing your own personal views is very important. And then obviously you do have to consult your legal department. In all of these cases, if there is any notion of a potential conflict, I cannot, well, none of us can possibly help you get to the bottom of it. So you usually have to end up looking at your own regulations or speaking to someone in your legal department to help you clarify those things. I will give you some examples. For instance, like this is sort of from the question that we received. Like if you work for a health insurance company, for instance, maybe something like is clear cut. Maybe you cannot advocate for a national health insurance system, right? I'm being very extreme, right? Because you work for a health insurance company. You're not going to advocate for something that extreme. It is a clear conflict, right? But maybe it's not such a big deal if you support protective equipment for physicians during the pandemic, right? And as a private citizen, you can attend a town hall, you can attend, you can send and sign up for an action alert, you can go to an advocacy event if you so feel the need to do so, or you want to. So understanding those nuances, and again, I cannot cover every single example here, but that's the sort of like thought process that you have to go through to understand. And when you do, for instance, if you end up going to a particular congressional outreach event, like you end up going for an advocacy event, it is very important to make sure that you clarify that I am so-and-so. You may tell them where you work for, but I am here as a private citizen, and this is what I'm interested in doing, and this is what the issue I am interested in, and this is what I want to do. So I want you to do, sorry. So, and you have to make sure that you don't show up in your company t-shirt or any such symbols, so that there's no conflict relayed that you may be representing your company or any other institution other than yourself. So just like those type of things. And one of the questions was, how do you advocate versus educate? I think that goes into who your audience is. If you end up talking to your peers, your colleagues, your friends, and tell them, you know, I'm very concerned about this issue, I can't advocate for it myself, but this is like, these are the nuances, just so you understand what is going on. And maybe they walk away with an idea about how to advocate for change, if you yourself are not able to, or not willing to, or what have you. But of course, if you go to a congressperson, it's kind of difficult. If you go to them and highlight a problem, it really turns into advocacy, really. So that would be my take on that question. And finally, there was a question about petitioning on the issue of racism, specifically to the National Governors Association. So I will say that, yes, you can petition the National Governors Association, you can petition the White House, you can petition everyone. The National Governors Association is a good start for sure. So yes, you can. I did see some action alerts from Doctors for America that were being done on a state level in general. And then I saw a White House petition that was circulated that I signed up for. I'm sorry, I don't have it with me. And there's a lot of petitions that are now circulating. And we will try to include some of those for those of you who are interested in looking at those petitions. We can include them in an email as well for you to participate or just review to understand how these things work. So I think those were the questions that we received by email, and we did try to cover some of the other questions that I may not have alluded to during the course of our presentation. And we can see if there's any further questions that are coming through.
Yeah, and if anyone else has any questions, feel free to enter them in the chat. We will be sending a recording once again after the call, either tomorrow or today. I see someone said, are the trainings specifically related to the pandemic? We can tailor our trainings to be related to different policies or examples that are related to different areas of the pandemic, and it's mainly just the trainings are geared toward, like, how do you as a citizen talk to your representative, engage with your representative. We do not have any trainings right now regarding police brutality. And is there any other questions?
If not,
we can end early. And we want to thank everyone for joining us today.
Thank you very much.
Yeah.
Yes. And all right, thank you. And we will send follow-up emails with all of this information and some of the additional resources that you mentioned. Thank you for joining, and look forward to staying in touch with all of you. And we will try to, based on your suggestions, tailor some of these trainings in the future for sure.
Yeah, thank you so much.
Thank you.
Take care. Bye.
Have a good one.